Welcome to my YouTube channel.
Panic. It began quietly, with a fever that seemed ordinary, a cough that sounded harmless, and a rash that parents thought might fade on its own. But measles does not announce itself loudly at first. It waits. And while the world looked away, it spread. Today, measles is once again making headlines across America, a disease many believed was gone forever, returning stronger, faster, and more dangerous than before. This is not history. This is happening now. Measles is one of the most contagious diseases known to humanity. More contagious than COVID-19, more infectious than influenza, and capable of spreading through the air for hours after an infected person leaves a room. One sick child can infect up to 18 others. In classrooms, daycare centers, airports, shopping malls, and hospitals, the virus moves silently, targeting the most vulnerable first: children. America once celebrated the elimination of measles. Vaccination programs had pushed cases down to record lows. Doctors rarely saw it. Parents stopped fearing it. And slowly, dangerously, complacency grew. Vaccination rates dropped. Misinformation spread faster than facts. And measles found its way back. The current measles outbreak in the United States is not just a medical issue. It is a warning. A warning about what happens when prevention is ignored, when science is doubted, and when society forgets the cost of diseases that once killed millions. The numbers are rising, but behind every statistic is a child, a family, a hospital room filled with fear. Measles begins like a common viral illness. Fever, cough, runny nose, red watery eyes. Many parents mistake it for a cold or flu. But within days, the fever spikes dangerously high. White spots appear inside the mouth. Then comes the rash, starting on the face and spreading downward, covering the body like a signal that the virus has fully taken control. But the rash is not the real danger. The real danger is what follows. Measles weakens the immune system so severely that children become vulnerable to other infections for months, sometimes years. Pneumonia is common. Brain swelling, known as encephalitis, can occur and leave permanent brain damage. Some children lose their hearing. Some lose their vision. And some do not survive. In recent outbreaks across America, infants too young to be vaccinated have been hospitalized. Children with cancer, immune disorders, or chronic illnesses have faced life-threatening complications. Pregnant women exposed to measles risk miscarriage or premature birth. This virus does not discriminate, but it always hits hardest where protection is weakest. Hospitals have reported emergency isolation measures. Schools have closed temporarily. Entire communities have been placed under quarantine. Public health officials scramble to trace contacts, warn families, and contain spread. But measles moves faster than paperwork, faster than policy, faster than public response. The heartbreaking reality is that measles is preventable. The measles, mumps, and rubella vaccine, known as MMR, is one of the safest and most effective vaccines ever developed. 2 doses provide about 97% protection. It has saved millions of lives worldwide. And yet, despite overwhelming scientific evidence, vaccine hesitancy has grown. False information on social media, fear-based narratives, and mistrust in healthcare systems have led some parents to delay or refuse vaccination. The consequences are now visible. Measles does not care about opinions. It spreads wherever immunity gaps exist. In some communities, vaccination rates have fallen below the level needed to maintain herd immunity. That means even vaccinated children are at risk, because no vaccine is 100% effective. The virus only needs one opening. What makes this outbreak especially alarming is how quickly measles can return once introduced. International travel allows the virus to cross borders easily. A single infected traveler can start an outbreak in an unprotected community within days. By the time symptoms appear, exposure has already occurred. Public health experts warn that without urgent action, measles could become endemic again in the United States. That would mean continuous circulation of the virus, not isolated outbreaks. A disease once thought eliminated could become a permanent threat. For parents, the fear is overwhelming. Watching a child struggle to breathe. Seeing a fever that will not break. Hearing doctors explain complications that cannot be reversed. These are realities families are facing right now. For healthcare workers, the outbreak brings exhaustion and frustration. Treating a disease that should not exist anymore. Explaining the same facts repeatedly. Fighting misinformation while trying to save lives. For children, the cost is the highest. Lost school days. Hospital stays. Long-term health problems. Trauma that lingers long after the rash fades. The measles outbreak is not just about a virus. It is about trust. Trust in science. Trust in medicine. Trust in collective responsibility. Vaccination is not only a personal choice, it is a community shield. When one person chooses not to vaccinate without medical reason, the risk is shared by everyone. Education is critical. Parents need clear, honest information. Fear thrives in silence. Awareness saves lives. Understanding how measles spreads, recognizing early symptoms, and knowing when to seek medical care can make the difference between recovery and tragedy. Doctors urge parents to check vaccination records, especially before school enrollment or travel. Adults who are unsure of their immunity should consult healthcare providers. Protecting children starts with prevention, not reaction. The return of measles is a reminder that progress in medicine is fragile. Diseases do not disappear forever. They wait for opportunities. And when vigilance fades, they return. This outbreak is not inevitable. It is reversible. With strong public health action, accurate information, and community cooperation, measles can be stopped again. But time matters. Every delayed decision allows the virus to move forward. America has faced health crises before and overcome them. The tools exist. The science is clear. The choice is ours. Measles is not just a rash. It is a threat. A preventable one. And the cost of ignoring it is measured not only in numbers, but in children's lives. Awareness is the first step. Action must follow. If this video helps even one parent recognize symptoms early, check vaccination status, or seek timely care, it could save a life. Share this message. Talk about it. Protect children. Because silence allows measles to spread, but knowledge stops it.